I'm Martin Boyd. I'm a consultant in emergency medicine in University Hospital Kerry. I've been working here since August 2011. Our department sees about 37,000 patients a year. They will be undifferentiated. Patients will self-present. They'll come with GP letters. There'll be adults, pediatrics, medical issues, surgical issues, trauma, a wide variety of presenting complaints, and our job is to identify the really sick patients at the front door and start their treatment as soon as possible to make sure that they get the right treatment initially. I worked in the UK for a long time, and I suppose potentially always wanted to move back to Ireland. My dream was to live somewhere near by the sea, and Tralee ticks a lot of that. I live out the Tralee-Fenit Road, and I look out the window and I can see the sea. My first job as an intern, so that's just out of, and I remember working for 7 weeks in an emergency department, and I loved it. The dynamic in it, the buzz, the challenge, that's all. I thought this is what I want to do. And it has sort of rewarded me throughout the years. There is good days, there are bad days. You save patients, you unfortunately have lost patients, but you try to deliver the same to each patient. And the challenge is that you don't know what is the next patient through the door. I personally think that every junior doctor should do at least 6 months in emergency medicine. If they don't know, even if they know what they want to become. We prioritise people according to their presenting complaint. So, and whoever then has I suppose a more severe illness or injury will get seen first. So it's not like first in, and that can upset people in the waiting room, because you could come into the waiting room and then people that come in after you are seen before you, because their illness or injury is that critical, and they should. Teamwork's essential. I mean, from the point of view, without all of these members of staff, the department couldn't work. And it is this integrated streaming where we all know what our jobs are, and we are able to sort of interact with the nursing staff, the portering staff, the domestics, the radiographers, and the doctors. It is all one unit within there, and it's a nice cohesiveness about it. I purposely parked the car well away from the front door of the hospital, so my idea is that by the time I walk over to the car, I would hopefully have forgotten some parts of what happened. Depends on what type of day I've had. If I've had a good day, I leave with a bounce in my step. If I have had a bad day, and we've had some bad, where patients have passed away on us or things like that, or difficult cases, I often find that they're difficult to leave behind. It's unfortunately that the ones you remember, well, the ones I remember, are the ones that I have had a bad outcome. And it's not the patient that I remember, well, it's the patient I remember, but it's the interaction with the relatives. And they're the ones that I find really, really challenging. The good ones, yes, you can often see patients that you come in and treat, and they make a successful recovery. They're brilliant to have, but the ones that I remember more so are the ones that have had the bad outcome, and I've then had to go and talk to the relatives and break their bad news to them. We'll say a patient passes away. I think it is human nature to look inward and say, have I done everything, and could I have done something, and that will often happen to me. And when I've done that, I've actually said, no, actually, when I reflect on it, and not just me, but we'll say the team reflect, I will often say, actually, we've done as best as we could, and we could not have done any better, But it's still very hard to lose patients. I think we all sing from the same hymn sheet, and I think that hymn sheet is, let's do the best that we can for the patients. So and I've often sort of said the mantra, how do you want your mother or your father or your brother, your sister to be treated when they come in as a patient? That's how we should treat every patient, and that's the type of mantra that we try and, I'm not saying teach, but approach them.